Alpha-gal syndrome, red meat allergy linked to ticks. 1. Understanding alpha-gal syndrome. Alpha-gal syndrome is a recently identified red meat allergy linked to tick bites, specifically from the Lone Star tick. Named after the carbohydrate molecule alpha-galactose, or A-gal, this allergy occurs when the immune system produces antibodies that recognize A-gal sugars found in red meat. The A-gal sugars are harmless when eaten normally, but once sensitized by a tick bite, the immune system sees these sugars as foreign and launches an allergic attack hours after red meat consumption, causing hives, swelling, low blood pressure, breathing difficulties, and even anaphylaxis. Reactions can be severe and life-threatening. 2. Tracing the connection to tick bites. Researchers began noticing a pattern in the southern U.S. of patients having mysterious delayed allergic reactions to red meat with no prior history of food allergies. The common factor was they had been bitten by ticks recently, particularly Lone Star ticks. These ticks transmit alpha-gal sugars found in their guts into the human bloodstream via bites, triggering the immune system to produce A-gal-specific IgE antibodies. Once sensitized, the body sees a gal in red meat as an invader and releases histamine to attack it, thus the delayed allergic reaction after eating meat. 3. Why is this allergy emerging now? Alpha-gal syndrome was virtually unheard of until the early 2000s. So why is this red meat allergy just coming to light recently? Several theories exist for the emergence of alpha-gal allergy. Spikes in Lone Star tick populations, which carry alpha-gal and thrive in warm, humid climates. Their range is increasing, possibly due to climate change. Greater awareness and reporting of tick-borne diseases. Our microbiomes and immune function are changing, possibly related to antibiotic overuse and less microbial exposure. 4. Key signs and symptoms. The primary sign of alpha-gal allergy is delayed allergic reactions to mammal meats like beef, pork, and lamb several hours after eating them. This can include widespread hives, swelling and itchy rash, nausea, cramps, vomiting or diarrhea, coughing, sneezing, runny nose, throat tightness, wheezing, trouble breathing, dizziness, fainting, or low blood pressure. Reactions generally start 2-6 hours after meat ingestion, unlike typical food allergy reactions, which are immediate. The delayed timeline reflects the time it takes the body to produce antibodies attacking the alpha-gal sugars. 5. Differences from meat intolerance. Some assume they have a red meat intolerance when experiencing GI issues after eating it, but alpha-gal allergy symptoms go far beyond an upset stomach and are immune-driven responses to a perceived threat. With intolerance, symptoms arise fairly soon after eating and may include heartburn, indigestion, belching, stomach cramps, gas, diarrhea. Allergy involves much more severe systemic symptoms that can be life-threatening and begin hours later, not directly after eating. 6. Risk factors and susceptible populations. Research shows certain populations have higher risk for developing alpha-gal allergy. Living in geographical regions with high amounts of Lone Star ticks, such as the southeastern and eastern U.S., frequent exposure to tick habitats like grassy, wooded areas, being bitten by multiple ticks, having certain blood types like B and AB, being middle-aged between the ages of 46, having a compromised immune system, or coexisting atopic allergies. While anyone can develop alpha-gal allergy after just one tick bite containing alpha-gal, these groups seem to be most vulnerable. 7. Getting a diagnosis. If you suspect alpha-gal allergy after tick exposure and delayed meat reactions, see an allergist for proper diagnosis through allergy blood testing looking for elevated alpha-gal IgE antibodies, skin prick testing where red meat extract applied to the skin causes a raised itchy welt, graded oral food challenge where red meat is consumed in medical setting and monitored for reaction, detailed history of symptoms. 2. 6 hours after meat meals and tick bite exposure. These allergist-administered tests, along with your reaction history, can provide definitive alpha-gal diagnosis, rule out other causes, and assess severity. 8. Foods and products to avoid. Once diagnosed with alpha-gal allergy, strict avoidance of mammal meats and products derived from them is crucial. Beef, lamb, pork, venison, rabbit, all red meats. Organ meats like liver, kidneys, heart, meat-based broths, soups, stews, gelatin-containing foods like gummy candy, dairy products, animal fats like lard or tallow. 9. Can you outgrow alpha-gal? Unfortunately, allergy to alpha-gal is not typically outgrown over time like some other food allergies in childhood. Alpha-gal IgE levels usually remain elevated for years after the initial tick bite, though they may gradually decline over decades. Traces can still trigger reactions. However, proper avoidance of red meat and retesting IgE levels yearly may help some tolerate small mammal meat portions occasionally long-term without reactions. Work closely with your allergist. 10. Preventing tick bites. Since tick bites play a key role in alpha-gal sensitization, prevention is critical. Use EPA-approved bug repellent containing DEET when outdoors. Wear light-colored clothing covering arms and legs. Stay on designated hiking trails and avoid high grass, brush. Inspect your body and clothing after being outside. Shower after spending time outdoors. Consider treating clothing. Gear with permethrin. Ask doctor about tick diseases prevalent in your area. Take all precautions to minimize tick exposure and bites. 11. Treatment of reactions. If you accidentally ingest alpha-gal containing food and have an allergic reaction, treatment involves antihistamines like Benadryl to reduce hives, itching, epinephrine auto-injector for throat swelling, low blood pressure, trouble breathing. Call 911. Prednisone or steroids to calm severe inflammation. Pepsid, Tagamet to ease stomach symptoms. IV fluids, oxygen, monitoring in ER for serious reactions. Work with your allergist to have emergency medications on hand. Identify your reaction severity triggers. 12. Supporting overall health. Though alpha-gal allergy can't be cured, supporting whole body health is important. Heal your gut lining, avoiding NSAIDs that increase gut permeability. Take a daily probiotic to balance your gut microbiome. Reduce inflammation with an anti-inflammatory diet high in produce, healthy fats. Stay active and practice good self-care to support immune function. Explore natural histamine, lowering supplements like quercetin, vitamin C. Though challenging, those with alpha-gal can still lead full lives by being aware and smart. Have you developed alpha-gal meat allergy after tick bites? How are you managing it? Please share your experience and tips in the comments. Alpha-gal syndrome is a newly identified red meat allergy on the rise due to the perfect storm of expanding tick populations, unawareness of tick diseases, and changing immune and microbiome function. While research continues prevention and treatment, being vigilant about tick precautions, getting evaluated for proper diagnosis, and avoiding all mammal meats and products is necessary to avoid potentially severe allergic reactions. Supporting overall health can help those with alpha-gal live well. Thanks for reading. Please like, share, and subscribe to stay up to date on emerging health topics. Disclaimer: this content is for informational and educational purposes only. It should not take the place of professional medical advice, diagnosis, or treatment. Consult your doctor if you suspect alpha-gal allergy.